Hi, my name's Josh, and I'm going to explain the concept of pain inventory and how it came about. So in the context of pain science education and reconceptualizing pain, someone's concept of pain is their beliefs and their knowledge about what pain is, why pain exists, and how pain is experienced. An assessment tool for this construct would allow us to individually tailor education about the science of pain and also evaluate the effectiveness by using the tool before and after education. Now, there were many steps in my PhD involved in developing this tool. We focused initially on 8 to 12-year-old children. So they were old enough to fill out a questionnaire, but young enough to not think abstractly. And we thought that was a really good starting point because if we can get that right, then it should translate into other populations too. So the point of this slide is to show you there were lots of steps, but basically there was an item pool of 21 items. And then in different populations now, those 21 items have been whittled down into different variations. I'm trying to minimize that obviously, but the initial tool has 14 items. And in 8 to 12-year-olds, the internal consistency was acceptable. Test retest reliability 1 to 2 months later was moderate. There was no proportional bias in terms of agreement. And the smallest detectable change was big, but in the data we have on adults, it's not 12 points, it's down to 3 points on the scale. So there's a paper there if you wanted to have a read more about that. Basically, these numbers, these R values aren't huge, but children whose knowledge and beliefs align better with contemporary pain science had lower pain intensity, lower functional disability, but they interestingly had higher fear of pain. And so we should probably assess fear as well. And in terms of predictive validity, having a higher COPI score was associated with better pain and function at the 1 to 2 months later mark. So this is what the 14-item questionnaire looks like for children. You can see there's sentences and then there's a 5-point response. So the instructions are, these sentences are about what you think pain is, why you feel pain, and how you feel pain. Please read each sentence carefully and indicate how much you agree or disagree with each sentence. And so the idea is that it's not about being right or wrong necessarily. The correct answer for someone, the most valid answer is if they are unsure, it might be unsure. And so there's a series of questions and the respondent goes through and fills out each item and then a total score can be calculated. So this is an example of what it might look like. Imagine 12-year-old Nora, she's had 2 years of back pain that's kept persisting. She fills out the copy prior to coming into an assessment that you're conducting. Do you think this questionnaire could change your assessment or your treatment or maybe both? I think so. So let me give you a quick rundown of how that might look. So you say to Nora, why did you tick unsure for the sentence, learning about pain can help you feel less pain? And then she responds, well, it's because I've never really learned about pain. I mean, I've got pain, but no one's ever taught me anything about it. What is there to learn anyway? And then in the behind the scenes, so you can see down the bottom, you've got this perfect opportunity to start teaching about the science of pain in a personalized way, in a way that the patient is now open to learning. So then you could go through and address all of the disagree ticks or the unsure ticks, or even go through the ones where she's agreed and encourage that. Does that make sense? So now let's rewind, go again. So Nora, why did you tick unsure for the sentence, learning about pain can help you feel less pain? This time Nora says, I just don't know. I don't really want to know. I just want to get on with it. I don't want to chit chat. And so in this situation, the tool is helpful in terms of targeting because you acknowledge and you can realize that she's not open to that education. So my very biased view, obviously, is that this tool could help in terms of that type of child or that type of patient as well. And I think it's important to note that there's plenty of people out there who improve their function without improving their knowledge. Some people just need to be told to get on with it and they do quite well, but others require this learning process. So when someone says, oh, look, I've already tried all these exercises to you if you're a physiotherapist, it may be true, but a response that you could use in terms of with the copy might be, yes, but the way that you approach them this time will be very different. And so you're priming expectations, you can then actively listen, you might provide some brief education. It doesn't necessarily take long. Say you're giving an exercise like walking or squatting or something like that. You might talk about the protective buffer being like a bubble suit. And that way you're encouraging that it's safe to move, to nudge into that little bit of pain. And then Nora might say, well, my old physio actually told me to avoid any movement that causes pain. And so then that's that moment where you can then say why. So you might say, why do you think exercise could help with your pain? Or why do you think exercise will help with your pain? And start kind of just expanding that conceptual understanding. So the key points here are to genuinely try to understand where a patient is at. And then I guess the other big one is that it's less about teaching a patient and it's more about the patient actually learning for themselves and actively participating. So the tool as of June 2021 is spreading and people are using it in different contexts. So there's a study we did with 627 adults. That paper's under review and there's a 13-item tool. In a pediatric pain clinic in the US, we're looking at children, adolescents, and their parents and how those scores interact. There's a study being set up in the school setting, looking at teachers' concept of pain scores, and then how they perceive their student who has pain to answer these questions. There's some cross-cultural translations, so Turkish, Danish, and German are all being worked on. There's a study in physiotherapy postgraduate students, and seeing if the adult tool works in that population. And another study where we're doing a single case experimental design with some new children's books I've been working on compared to a placebo education process. So that's where things are up to, and I really appreciate your time. And please let me know if you have any questions. Thank you. Bye.